Hey y'all, hey, greetings and welcome. It is Dr. Cherry Estelhomme, and I wanted to spend some time going over some of the crisis models. All right, let's get started. Here we go. So in taking a look at some of your outlines, I noticed that many of you have kind of taken the easy route and chosen Gilliland's six-step model. And I think you've chosen that because I did a video on it. However, there's so many more models out there. You just got to do a little bit of work and some research. So let's look at some of the models that are out there, okay? So for starters, we do have the Gilliland six-step model. Gilliland's is a client-led model, and the purpose is to give power back to the client. This is a model that's usually good for someone who's been sexually assaulted because it's a collaborative model and it empowers the client. We also have Roberts Crisis Intervention Model, also known as Roberts 7-Stage Crisis Intervention Model, or the RSSCIM. And so this model is useful to clients who present as a state of consequence for interpersonal conflict. So Roberts is good for someone who's, thinking about suicide or has gone through a very traumatic breakup, a divorce, or a romance. It can also be good for sexual assault or even dating violence. And this model is also good for pre-existing mental health problems that could flare up, okay? Roberts is kind of universal, so you can also use this model for something that triggered an event as a result from a natural disaster. So if there was some kind of, mental health issue and it was triggered because of a natural disaster, then you can also use Roberts. Again, Roberts is kind of universal, so it can be used for someone who has suicidal ideation, they're going through a horrible breakup, even a divorce, or someone who's having some kind of pre-existing mental health flare-up, okay? So another one that may be pretty familiar to many of you is the ABCX and the double ABCX model of crisis. This model originated from Reuben Hill during World War II. And so you have these different acronyms, whereas A is the stressor event, B is the family's resources, C is the meaning that the family puts on the stressor event, and then you have X, which is the crisis. The difference in the double ABCX is that the double, it includes the stressor plus the buildup of other stressors, resources that are tangible and intangible, and then recovery and growth after the crisis. And so many of you may be familiar with the double ABCX, the ABCX and double ABCX, because they're pretty highly outlined within our textbook. The next one that many of you may be very familiar with is psychological first aid, also known as PFA. Keep in mind that PFA is not psychotherapy. It's not a substitute for therapy, but it's usually literally that. It's first aid. It's psychological first aid. When you're dealing with PFA, you want to assume that you are dealing with normal people who are having normal reactions to an abnormal event. Right? Normal people who are having normal reactions to an abnormal event. And so the goal with PFA is a practical tool that can help a client to reduce stress levels. And so there's 5 principles. So the principles are safety, calmness, connectedness, self and community efficacy, and then instilling hope. Again, that's safety, calmness, connectedness, self and community efficacy, and instilling hope. But remember, psychological first aid is literally on the scene or helping a client shortly after a traumatic event. All right. The next one is the task model of crisis assessment and intervention. This has gone over in your textbook pretty widely because one of the authors of our textbook is the author of this model, Jackson Cherry. And the task model of crisis assessment and intervention has, 2 caveats. You have the assessment caveat, you're going to do those 4 steps, and then you have the intervention caveat. And so remember, whatever model you choose, you're going to walk your client through each and every one of these steps. So be familiar with what they are. And the task model of crisis assessment intervention is actually really, really good because it's very synchronous. And so clients who need structure and who are, good with steps, this is actually a good model for somebody like that. All right. So then one of the more commonly useful grieving models is the dual process grief model, the dual process grief model. And so this model is frequently identified in literature that it's used to guide children who are, who are going through bereavement and who are grieving. And so this model asserts that there's two types of stressors following the loss of a loved one: the loss-oriented stressor and the restoration-oriented stressor. And so a lot of articles, they explain that a bereaved child will either focus on the loss, meaning they'll dwell on the loss of their loved one, or they'll focus on the restoration, meaning they will focus on adjusting life without the deceased. So the dual process grief model is really, really, really good. When we say children, a lot of research has been done on this model in children, but this model can be used for adults as well. And so if you have someone who just lost a loved one, but they still have to maintain, they still have to, provide and take care of their children, this might be a really good model to consider, the dual process grief model. One of the most beneficial models that I've come in contact with is the complicated grief therapy, CGT, complicated grief therapy. In this model, it looks at an actual person's grieving process. How are they going through this process? And they look at the acceptance of loss and adaptation of life without the deceased. It's kind of almost like the dual, but the complicated grief kind of deals with when there's other issues, just the loss, when you're looking at the relationship, when you are looking at the manner that someone passed. This is usually good for survivors of suicide, or even for survivors of service members. So CGT, it has 7 core themes, and these themes will, really help you as a therapist guide your client to a healthy way of accepting the loss. So the complicated grief therapy is one that is really, really good to have in your toolbox. So take a look at that. So as we're looking at trauma, one other area that we cannot escape from is those who have suicide ideations. And so when we look at someone who may appear to be suicidal, who life kind of feels like there's no hope, one of the models that you might want to use for them, especially someone who's attempted before, is the collaborative assessment and management of suicidality model, which is the CAMS model. Again, that's the collaborative assessment and management of suicidality, CAMS, the CAMS model. And so this CAMS model, it was developed to help clinicians adjust their approach to how they conceptualize and treat clients who actually have this suicide ideation through self-reporting or through screening. So if they've taken some kind of screening and it's shown that they might be at risk for suicide, CAMS model is really, really good for them. And so what the CAMS model does is it emphasizes a strong working alliance between the client and the counselor, and it really induces hope for the client. It helps the counselor give the client, some kind of hope. It helps the counselor to take the client to a space where they can see different areas that hope may be. It's an evidence-based model. It is a model that has been used quite a lot. And it has been shown to work. And so if you have a client and they've experienced a lot of trauma and they're feeling, really helpless and hopeless, the CAMS model might be a really, really good option to kind of just get them from the edge to a space where they want to live. Okay. So for the sake of this recording, I'm not going to go through all of the other ones, but I do want to give them an honorable mention. Okay. So when you're looking at things like sexual assault, you can look at some cognitive process models as as well as trauma-focused cognitive behavioral therapy. Again, sexual assaults, you can look at cognitive process models as well as trauma-focused cognitive behavioral therapy. When you're looking at someone who's experienced just horrific trauma, you can look at exposure treatment. When you're looking at someone who's experiencing intimate partner violence, the Duluth model is really, really good. The Duluth model has proven to be really, really good for IPV victims. So if you have a client who's dealing with that, definitely take a look at the Duluth model. You know, we've already talked about the task model, crisis assessment and intervention, but I also want you to be aware of the psychosocial transition model, as well as the equilibrium model, the development ecological model, the contextual ecological model, and the eclectic model of crisis intervention. And so this list is not meant to be exhaustive. The goal in me just doing this quick video is to let you know that there's way more models out there. And there's, again, it's not exhaustive. So there's a lot of different crisis intervention models out there. The goal is you want to make sure that you understand who your client is, and you want to choose a model that will work best for your client. Okay. I hope you found that helpful. Let me know if you have any questions, and I'll be happy to do my best to answer them. All right. I hope to talk to you again soon. Thanks for listening. Have an amazing day. Bye.